Good morning. Good February 1st morning. Already, second month of the year of 2021. It's David, and yesterday I had posted that I was going to do some WebMD emails that I got. I was going to talk about them, share information, things that got my attention that I thought might be of value to you. And as I was preparing for today, I came across an article that obviously got my attention, and I wanted to change the format a little bit. So today, I'm actually going to spend some time talking about the heart. Something that I have a lot of experience with, something that I have been challenged with for 72 years. And we're going to talk about, I'm going to talk about the heart, share some experiences, share some things that I hope you will do for yourself and for obviously your family and your loved ones. Then I won't be doing a broadcast tomorrow morning, but I plan to do one tomorrow afternoon with a very special announcement. Then Wednesday, Thursday, and Friday, I will take some WebMD articles. The ones I'm looking at right now, top cancer-fighting foods, 6 foods you should never wash, low blood pressure warning signs. That's a good one, and I've got some experience there. Why belly fat forms and how to lose it. I definitely have some experience there, but I will also share some personal information in that area. And morning habits, more things you can do in the morning to get yourself going for hopefully a healthy, safe day. And I saw another article I wanted to share, how your body clock changes as we get older. So we'll deal with those items a little later, or later this week, I should say. Okay, to the heart. I have taken special interest in my heart, seeing as I was born with heart disease 72 years ago, and literally did not know that I had the heart disease until I was 42 years old. And there's reasons for that. The reasons basically being that technology certainly wasn't years ago what it is today. And along with technology comes knowledge, enhanced knowledge. And we've learned a lot about the heart in those years, in the last couple years. But it's amazing how much that we didn't know about the heart. And one thing I might interject at this moment, I don't know how to emphasize it any greater, but the number one killer of women is heart disease. Yet through our lives as we were growing up, heart disease was always a male thing, and not much consideration was given to females. But females need to take a closer look at their heart, see what's going on, and we'll talk about that thing in a moment. So 47 years ago, my father died suddenly. He died 30 minutes after a doctor had told my mother that he was going to send my father home the next day. My father was in the hospital for something unrelated to his heart. And before my mother got home from the hospital, my father had died. And the his doctor, who was not a cardiologist necessarily, he was a primary care physician and an internist, and he was totally, totally beside himself. Uh, and so he asked my mother if he could do an autopsy. And my mother pretty quickly responded, didn't take too much time to think about it, said, if you're going to learn something about my husband's death, please do the autopsy and share that information with us, obviously. Well, the information was shared with our family. 47 years ago, our family was told that what my father died from was not genetic. And 20 years after that statement was made, literally 20 years after, my brother was seeing a doctor and for just a standard checkup. And the doctor said, Howard, I hear a heart murmur. And my brother asked, well, why haven't you told me that before? And the doctor's response was, I had never heard it before. So the fact that he was hearing a heart murmur with my brother, who was in his 40s, action needed to be taken. So it escalated. And it was determined that Howard was going to have surgery. What they found out as they did some MRIs was that Howard had an aneurysm at the base of his aortic valve. We also learned at that time that Howard and I were born with aortic valves that have two flaps to them and not three. So, and also we were born with enlarged hearts. Enlarged hearts isn't anything extraordinary. I don't know what the percentage of folks being born have enlarged hearts, but stepping back for a moment, when you see or read or hear about an athlete who playing basketball on the basketball court collapses and dies, the chances are very good that that athlete had an enlarged heart. Not enough attention has been paid to enlarged hearts over the years, because in my case, being born with an enlarged heart and with a valve that was inefficient, only operating at 67% efficiency, the heart had to work harder, being enlarged, work differently and harder because of the valve itself. So what was done with my brother, the aneurysm was repaired and a new mechanical heart valve was inserted. So we knew that was going to be in my future, the exact same two procedures. Because when I learned about Howard and what was going on with him, I was living in Cincinnati. My brother was living in Canton, 250 miles away. I went up to Canton to have an appointment with Howard and his cardiologist together so we could look at the situation. And I had obviously more data in my lifetime just because of things that have happened. So we knew what needed to be happened. Interestingly enough, it was that my father's aneurysm exploded, and that essentially is what killed him, was the aneurysm. So obviously, my brother and I were extremely fortunate that the situation was discovered, and we were able to do something about it. Surgery. Another interesting thing, from the time that Howard was told of his condition and that, in fact, uh, he would have open heart surgery to uh, repair the aneurysm, and to put a new valve in, a mechanical valve in. Howard had 30 days from the time it was told till he actually had his surgery. After his surgery, since we knew that I was going to be going through the same, he told me everything that happened, and he told me what the exact warning signs were going to be, because he actually had felt some of these things just prior to his surgery. He told me about a pain, a very intense one, that would radiate uh, from the back of his body to the front of his body. And that's how that worked. Let me step back from that point for a moment, because something else happened in my life with a cardiologist that the cardiologist never paid a great deal of attention to, and that, in fact, was um, after my surgeries in 1994. I would get um, echocardiograms on a pretty regular basis. And on one echocardiogram, and for 10 years, I had the same, um, I had the same lab technician do the echocardiogram. So that lab technician knew more about my heart than any cardiologist, because he actually viewed it that many times and passed the information on to the doctor. He gave me an echocardiogram, and I saw this forlorn look on his face, and he wanted me to go from a laying down position to a seated position, and see how I felt. That I didn't really feel bad, but he saw something that he wasn't exactly sharing with me. He said, "I need to go get the doctor, and we'll come back in." And then I knew, I I knew I was potentially in danger if he was leaving the room to get the doctor to come in and see, to actually view my echocardiogram. So, how what they saw in the echocardiogram was something on the backside of my heart that they had never seen before, because the equipment that they had, the technology that um, they had just gotten some new equipment that allowed them to see the backside of my heart, which up until that time, uh, they didn't see the backside of my heart. They only saw a frontal view of it and how it worked. Well, my heart was afibbing, and that was not really causing discomfort, but afibbing meant my heartbeat increased. But I also had a fluttering in my heart over the years, and that is where the heart slows down and it feels like it skips a beat. So I definitely had a challenged heart. The doctor, and he was the head of the cardiology department at that particular hospital, didn't do anything, didn't go any further with it. 2 years later, after that particular incident, I passed out after teaching an exercise class, came home, passed out, um, hit my head on my bedroom wall with the loudest crack I've ever heard in my life. And 48 hours later, I walked into the UC Health, walked into the UC Health emergency room by myself. A friend had dropped me off at the front door, walked in with a blood clot on my brain. I had hit my head so hard that a clot formed. Now, uh, two things. Uh, because of my mechanical heart valve, I have to take a drug called warfarin, um, commonly known as rat poison. Literally, look on the label of uh, rat poison, and you'll see the words warfarin. I've been taking that drug for 26 years now, 27, almost 27 years. And the reason I haven't, it's the only thing that can be done. The reason that I had to take it was that I have to take it is because to safeguard uh, a clot from forming near my mechanical valve. And if a clot forms from the near the valve, it's very easy transformation to get into the valve and go right to the brain. And so um, that was one thing that we discovered. The other thing that I just found out today or yesterday, as I was reading an article about the heart, was that one of the reasons that aneurysms form in the aortic valves is because of um, uh, rheumatic fever. My father had rheumatic fever, and it was recognized and defined. He had rheumatic fever. That, in and of itself, caused his aneurysm, probably. We don't know for sure. We'll never know for sure. But I found out in my reading that is one of the reasons for an aneurysm. Once again, um, nothing was done over the years because the knowledge wasn't there, the technology wasn't there to understand, to interpret, to evaluate, to visualize, to see. So, why am I talking about this part? Uh, I encourage everyone watching and to share the information for your friends, to loved ones. At some point in time, if your heart has never, if you haven't had heart concerns, please uh, go to your doctor, your primary care physician, arrange for an echocardiogram uh, under supervision with a cardiologist so you can get a baseline. So you can get a baseline, a guideline, so you can see what's going on. Um, and when should you do that? Well, it's never too early to do something like that. I would think that certainly at age 60, if it hasn't been done, do it. Uh, if you can get it done earlier, please do. Oh, back to enlarged hearts for a moment. After my surgery in 1994, within a month or two, my sons, who at that time were 7 and 8, my sons were 7 and 8 at the time. They were to go to a research lab at Children's Hospital here in Cincinnati, uh, and a cardiologist back in those years um, put my sons on a beta blocker. It's called a Telenol. Real strange beta blocker because folks take it for I've taken it in my lifetime for a different reason than my sons. So my sons were put on a regimen of a beta blocker, and in 18 months, their enlarged hearts, which were out of range, their hearts essentially stopped growing as hearts do when you're younger, and the size of their heart went from out of range into a normal range in 18 months by taking the beta blocker. So that's how far technology has come, and you can rest assured that all of my 5 grandchildren will be checked early on in their lives, their hearts, to see if they have potentially inherited some genes, actually from their fathers. Enlarged hearts were the only condition that, thank God, that my sons have had to deal with in their lifetime. And they've been checked. Way back then, they were checked every year. Then it went down to every 2 years. Then it went down to every 5 years. And actually, both of them are due soon to get another checkup on their hearts. And so, they'll be there getting it checked out. So please get your heart checked out. Okay, so let's talk a little bit about your heart and exercise. As you know, or may not know, I have been an exercise instructor for 15 years, specializing in cardiovascular aspects of exercise because I had to. I had the situation myself. And you've heard me tell the story before. Back in 2009, when I passed out, the reason I passed out was AFibing. My heart muscles were dangerously, potentially critically low, the strength of the heart muscles. When you get an echocardiogram, you get a number that's called an ejection fraction. The ejection fraction tells you the strength of your heart muscles. Back in 2009, my ejection fraction was 30. Danger level is 35. So I was below the danger level. I started to build, as an indoor cycling, spinning instructor, I started to develop an exercise for myself, which would hopefully strengthen my heart muscles. How was I going to do that? I was going to do things to stress my heart, something out of the ordinary. What I was going to do was to elevate my heart rate for a short period of 5 minutes, 10 minutes, maybe as much as 15 minutes, those 3 time periods. So there would be a slow or a fast incline of my heart rate. And lo and behold, taking that, and then not only elevating the heart rate, which is the main purpose of exercise, is to elevate your heart rate. There's other things that you try to do: muscle strength, muscle tone, skeletal alignment, extremely important. And we're going to talk about skeletal alignment because I've gone through some major challenges just recently. And as I did some things to enhance my skeletal alignment, it helped the situation. Lower back pain, some knee discomfort, not arthritis, because I've had arthritis in my knee, but it was something other than arthritis that was causing the discomfort. for my knee, but as I changed my skeletal alignment, it helped those situations. Okay, heart rate. Uh, how high should you elevate? How high can you elevate your heart rate? Because for each individual, it's a different story. It is unique to the condition of your heart. A common guideline is 220 minus your age. Oh, and I see Dave Varga is watching. Dave Varga was my original mentor uh, for cycling. And so we have talked about the heart many times over the years. Thanks for stopping by, Dave. Uh, we a common guideline, an accepted guideline, has been 220 minus your age would be the maximum rate, maximum elevation of your heart rate. That's kind of a guideline. As I was strengthening my heart, I was able to exceed my 220 minus 50, and or 220 minus whatever my age was at that time. So stepping back, 220, if your age is 50, 220 minus 50, your guideline is that you could, your maximum heart rate would be 170. Once again, that's going to change by individual depending upon the condition of your heart. It's important to have an understanding of what your heart rate is while you are exercising so that you can understand how high you can take your heart rate, how high should you take your heart rate, and if you can only elevate it to a certain level, maybe your heart needs some checking. Listen to your heart. I can actually hear my heart because of the fact that I have a mechanical heart valve. If I listen closely, I can hear my valve opening and closing. That has been a challenge over the years for sleeping, but since it's 26 years old already, I've got that pretty much under control. I do sleep on my side. I have found sleeping on my side, my oxygenation is better. I've had episodes of sleep apnea over the years. My oxygenation is better. Uh, and speaking about better oxygenation and the fact that Dave Varga is here, Dave, I'm sure you remember when you were teaching us to learn to breathe through our nose. And your comment was that your brother had taught that breathing technique to Navy SEALs. Well, if you're going to teach those kind of breathing techniques to Navy SEALs, you know that it's going to be important for us as we work on our breathing and our heart health. To that point, and I don't know if I've ever told you this, Dave. Every night before I fall asleep, I go through a breathing exercise where I take deep breaths in through my nose. I hold it for about 5 or 6 seconds, and then I release it. And I do that 3 to 5 times, closing my mouth, and then I do it 3 to 5 times, opening my mouth, so that I have plenty of oxygen getting to my brain. And my brain needs all the help it can get. So I have found that that gets me to sleep, kind of rests my body, helps me to go to sleep, and for the most part, helps me to stay asleep. I only sleep 5 or 6 hours a night. I've been doing that for virtually my entire life. So that's what my my biological clock uh, does for me. But when you're exercising, think about that breathing. Deep breaths in through your nose and release. Now, I hold it when I'm just not exercising, I'm just at rest. It will help you. Uh, how much it'll help you, you have to check with your primary care physician and your cardiologist. Okay, so 220 minus your age is your theoretical high rate, high heart rate. So that is something for you to work towards, that theoretical high. After a certain period of time, and you determine that based upon your regimen, based upon your routine. For me, it was 5 minutes, 10 minutes, 15 minutes. I stop and then I take a rest period where I, I see how quickly my heart rate will drop from a high level. Now, that is that is a more important measurement and consideration than how high you can elevate your heart rate. Uh, so we as individuals, when we're exercising, we control how high we take our heart rate. Once you get to the high rate, you can't stay there long, and you don't want to stay there long. You only want to be there a few seconds. Uh, you don't want to pass out, but it's not a bad thing, a wrong thing to elevate your heart rate. You just have to know how much you can elevate it. Okay, so dropping your heart rate, how quickly do you drop it? If you can drop your heart rate 20 beats a minute, and I'm not sure if that changes with age. I really haven't delved in, but maybe I should to see if that particular um, metric changes with age. If you can drop your heart rate 20 beats a second, your your heart muscles are strong. How do you measure your heart rate while you're exercising? Um, the old time way of doing it. I don't know, Dave. Let me know if you still do this when you're measuring your heart rate. But we used to wear heart rate monitors. We would put a band around our chest, and we'd have a watch, and um, the band would measure the heart rate and send a signal to the watch, and then it would tell us what our heart rate is. I haven't used David. I haven't used a heart rate monitor in years, basically because I kind of know where I am. But the other way to measure heart rate without that band, and I don't do it because of my mechanical valve, and I can't hear beats properly. So for normal folks, if you put two fingers there, or you put two fingers here at your carotid artery, you should be able to feel your heart rate, and then you just count. In an exercise class, when I'm having the class measure their heart rates, I have them find their heart rate. They count the beats. I count how many seconds. And at 6 seconds, I tell them to stop counting. Whatever number it is, if you multiply it by 10 or just add a zero to that number, that is what your heart rate is at that point in time. So it's a way to do it. It's if that's the only way you can do it, fine. Also, too, I downloaded a heart rate monitor on my phone, and there's several out there I've seen. Um, the one that I downloaded once a week, I suppose it could do it more often. It reminds me to take my heart rate, which I do, obviously. Okay, so uh, I think the last thing I want to talk about is resting heart rate. Um, and that too is a very, very individual thing based upon the strength and condition of your heart. Uh, I, my friend, my mentor, Dave Varga, just signed off, left a message. Thank you, Dave, for joining us. Uh, Resting heart rate, the better shape that your heart is in, the better condition that your heart is in, the lower your resting heart rate will be. For example, Lance Armstrong, who in his day pushed his heart as hard as anybody can push a heart, had a resting heart rate in the low 30s, which is extraordinary to have a resting heart rate that low. And he was in his 40s or more, well, 40s, when he had a resting heart rate of 30. Uh, I have found, and there's absolutely no science to it, but for me, I have found my resting heart rate is very close to whatever my age is. As I said, I'm pretty sure there's no science uh, involved in that at all, just coincidental to me and my heart. So those are some guidelines to work with. Uh, Please uh, take the time today, tomorrow, the next day. I know that we're all concerned about us older folks are concerned about getting vaccinated for COVID-19, but also be very much concerned of the condition of your heart, not only for your sake and safety and health, but for your dependents, the folks who you have passed genes on to, and they have passed genes on to share that information. It's very important to have a handle on that. So that's pretty much what I wanted to discuss today: the importance of a healthy heart. As I said, I have worked extremely hard over the years to strengthen my heart, and because I had to, I did not have a choice. Well, the option was, you know what the option was. So I chose to do what I can to strengthen my heart muscles. That'll be it for today. I will not be broadcasting tomorrow morning. I anticipate broadcasting tomorrow afternoon. We'll have to see then. But Wednesday, Thursday, Friday, about this time, maybe 10 o'clock, maybe 10:30, I'll let you know the day before in my story section what time I'll be broadcasting the next day. My name is David, and um, have a safe day. Have a healthy day. The next time I see you may be the very best time I see you. Take care.